ask everyone now to put yourselves on mute, just so we keep it as quiet as possible. And let me welcome you. So this is for the Pathways Project, an orientation to the process and details of data collection. I'm Dale Lupu. I'm one of the co-PIs of the whole project, of the Pathways Project. And on the phone, we have Kim Linton, who you may not have met yet. She's our data analyst. And Sherry Sliwa, who is our project coordinator and also our whiz at muting people when needed, and will help us with all of that. So today we're going to dive into what the data collection is about for Pathways. I think that some of you on the call today may actually be turning this over to someone else to do the monthly data collection, but this will give you an orientation and help you decide like who on your team is really going to do this. We're recording the webinar, so it'll be posted, so you can always have someone else watch it. And Kim is going to be available to do one-on-one kind of technical assistance if that's needed. So let's dive in. What we're hoping to do today is just give you the overview of what are we collecting, why, and how we're going to do it, to describe the 3 key reports that will be the data collection process, and to spend just a little time if you have questions and thoughts about what is the process going to be at your site, who is going to actually be managing the data collection, and then open it up for your questions. So I think most of you have had the big overview, and many of you were at the learning session with us. Thank you. But I think a few of you have not yet been really oriented to Pathways. So just to give you that very big picture, what we're trying to do is really learn something about how to transform the culture of ESRD care, so that instead of it being a one-size-fits-all kind of conveyor belt, we really individualize it and are providing care that is tailored to the goals and wishes of patients. And we are talking specifically about patients who are what we call seriously ill. So those patients who have many comorbidities, frailty, often are very old, but not always, and really may value things like quality of life, and we need to ask them about it. So what's key to this project is that we are intentionally identifying those patients I talked about, those who are really the seriously ill population. And we expect, it depends, it varies from a site to site, but in the literature, when we use the surprise question to identify seriously ill patients, it's somewhere between 10 and 20% of a CKD or ESRD population. And these are the patients who have an elevated risk of dying in the next 6 to 12 months. And then once we've identified them, it's engaging them in conversations about their goals and their wishes, and then offering options of care that gives them some more choice instead of just being on, as I said, on a one-size-fits-all prescription for dialysis. What Pathways Project is doing is providing tools and resources to help with the innovation that's necessary to make this culture change. And this is what we're talking about today, collect the data that will help us see if we're on the right path and document that this is a good innovation. We're using an approach that comes from the Institute for Healthcare Improvement. It's called a Breakthrough Collaborative. The Breakthrough Collaborative is bringing together teams to create a shared learning environment, to create a network. So you guys are where the real learning takes place, but it's not just one site. You are going to be teaching and learning from each other. And this is because although we know what we want to have accomplished, which is the change package you see on the right of the screen, so this change package that has 14 best practices organized into the 4 areas of supportive care capacity, values guide care, just right care, and throughout the continuum. Those are the 4 targeted areas we're working on. We know that's what we want to do, but how to actually get that embedded into a dialysis center and into a CKD practice, we don't know. That's what you're going to help us figure out. We're all going to help each other figure out and make the innovations that make this become a real living part of the care culture that you are providing. So the way this is organized, we have 3 in-person learning sessions. We just had the first one, and there were 12 teams participating from 4 organizations. And then in between, we have the action periods, and so that's what we're in now. Action periods are when you go home. We taught you all this great stuff. You had an opportunity to dialogue with each other. You had an opportunity to dialogue within your own teams. And then you're going home and you're testing, making these what we call small tests of change. And that's where you begin to collect data and report it to the central, us, the Pathways team, so that we can then put it all together and report it back to you. And that is part of what underscores the shared learning. There are 3 levels of measurement that are going on in the Pathways project. So the first level of measurement, which I'm calling here site-specific, is how you choose to measure a small test of change that you undertake. And that is data that you keep at your site. It's really only quality improvement. We don't ever want to see that data particularly, unless you choose to share an outcome with us. It's really the kind of thing that you might be doing a 2-week test of something or a 1-month test of something, and you might report to the whole group the outcome, that this worked or that this didn't work, but you're not going to report the data. Then we have level 2, which is mostly what we're going to talk about today, which is the quality improvement benchmarking. That's where all sites are reporting the same measures, and we're going to put that all together, and we're going to benchmark. And it's not meant to be, these guys are failing and these guys are succeeding. It's really meant to be, wow, look, they just had a breakthrough. They just figured out how to move so that they can get those goals of care conversations going with people within 30 days of coming back from a hospital. How did they do it? And that site's going to say, yeah, we did this. It's working for us. So that's the purpose of the benchmarking. And this is a monthly report, and that's, as I said, mostly what we're talking about today. There is also a component that's project evaluation, and that is data that's collected only in the baseline period, and we're in that baseline period now, so this first 3 months of startup. And then we will again have a follow-up period at the finish of the collaborative, when we'll collect the baseline data, the follow-up data again. It's the same thing we collect in baseline. We'll collect it and follow up again. There are multiple components. There's some surveys in that. We're not going to spend a lot of time talking about that today. The thing we were going to talk about is the patient-level data that will be collected now for 3 months, and then again at the end of the project. And the things that we're collecting in the actual items collected are very similar to what's collected in number 2, benchmarking, but it's collected and reported at a patient level. Here is the timeline, kind of a view of the timeline. So those green bars are the 3 learning sessions. One just happened in April. We'll have another one in the fall of this year, and the 3rd one will be next spring, presume in April. And in between are those action sections. So the first thing here, the first couple lines, these are the surveys. So one survey is to patients. We'll talk a little bit about that. You are not doing that survey. You are not consenting patients, but you are identifying the patients that will become the people we reach out to from the central interviewers to participate in the baseline and follow-up survey. And then there are 2 surveys to staff themselves. Those are in the field now. I think many of you have completed, I hope you have completed what we call the Kidney Supportive Care Implementation Quotient Survey, which is basically asking how well you feel you currently do at Kidney Supportive Care, how your team does. Then there's a chart review that is done once in baseline and once at the end of the project, up to 30 charts, only seriously ill patients, and just done once for each of those patients. And the seriously ill patient level demographics and utilization. And that's done now through July and again for 3 months at the end of the project. And then what we're going to mostly talk about today, we'll talk about the patient level data, but what we're going to mostly talk about as well is the facility level indicators that make up the monthly report. That's the overview. And I do want to remind you, we're sending the slides to everyone, and you'll also be able to download them, and there's a operations handbook that will be coming out to you. We didn't want to overwhelm you with the material ahead of time, but you get all this, you can refer to it again. So for everything that we're collecting, the data that we're collecting in the monthly reports and the patient level reports, there is an Excel template that you enter the data into, and then there's a Word document that's an instruction sheet that defines the terms. So there's a place to put the data, and then there's some instructions about exactly what's the reporting period, how do you collect it, and what are the definitions. So those are available, and you'll have those. And so now I'm going to turn it over to Kim to begin to take you into the details of the monthly facility report. And she's going to really show you what's in it and how you enter it and what this is all about. So Kim, let me turn it over to you. Do I need to give you the ball? I think I do. I think I can do this. But I don't know which.
Is everyone seeing my screen?
Yes.
Okay, great. Hi, everyone. My name is Kim. I am the data analyst on this project. So right now, we're just going to really go deeper into what the reports look like and kind of what the guidelines are for each report.
Excuse me.
Hello?
We're good.
I'm sorry.
Oh.
Somebody.
I'm sorry. I'm all ears.
Alrighty. So the first report is going to be the monthly facility indicators. And on this report, you're really going to be providing to us the patient level, facility level measures. And what that means is we only want a count of the patients in your facility that meet that measure. So we may ask how many patients were hospitalized. We just want you to say it was 10. We don't need a patient list or anything like that. There is a reporting feedback process on this where we would like the data. Is everyone hearing me?
You are very hard to hear.
Okay. Is it too fast or am I speaking too low?
Well, I'm hearing you well. This is Dale. You could slow down a little.
This is Sherry. You're also a little bit faint, but I can hear you. But if you could just.
Can you hear me better now?
I think so, yes.
Okay. So what I was saying is there's a feedback process for it where we want the data as soon as the month ends so we can create graphic visualizations and get the data back to you so you can begin to implement changes right within the month as well as see where you're doing really well at, identify areas that need the most improvement, and begin to really work on those processes as soon as you get it. And that's why we have a time frame of the report for the reporting month is due in the 5th of the submitting month, meaning that when you collect data for the month of May, we ask that you send the report back to us by June 5th, and that allows us to compile graphic visualizations and send it back to you so you're able to see how you're doing, identify the areas to improve. It's also really helpful being part of a collaborative where you could say we're not doing well in this area. Communicate with other facilities who are doing well in that area to begin to discuss with them and say, what are you doing, and kind of trade the best practices. The Excel spreadsheet template for this report will be it's called Pathways Data Reporting Template. And within that Excel spreadsheet, there's 2 different templates, one for dialysis centers and one for CKD centers. So when you begin to enter data, you want to make sure that you are answering measures and reporting data for with the site that's more applicable to you. This is what the spreadsheet looks like. So at the top, you'll be able to enter your dialysis center name, and I'll show you. Actually, I'll go to it right now.
Or superstars right now are the ones they're using.
So this is what the template looks like. There is an overview cover sheet, and so you'll just go in and fill in the data. So we ask that you give us your site name. There is a drop down where you can just go ahead and select your site. If you enter anything in this field that is not a site name, it will give you an error message because it is validated. So if you see I can't enter K, I have to select from the drop down and select the site name. And then we ask for other data such as the name of the person collecting the review, the date that you completed the seriously ill patient list, and the date the data is collected. And then we just ask for kind of a qualitative overview of how you're doing and ask you to fill in these questions here. So this is what the actual sheet looks like. You'll select your site name, you'll select the reporting month, and then you'll enter in patient level accounts here for each of the measures listed over here. And again, if any of these measures are confusing to you, or you don't understand them, you will have the instructions that define all of them for you. So it's a really good idea when you begin to report the data to have the spreadsheet open and have the instructional document side by side so you can refer back to each of them. And so when you're on this document, you will only enter data in the gray and white areas, and the yellow areas will automatically populate for you. So as you're entering your data, you will be able to see your actual percentage and see how you're doing right there. So for example, if your facility has 300 patients, you just enter 300. Top row of all of the spreadsheets is kind of like the baseline for that. And the percentages below it will calculate based on this denominator. So for total patients screened with surprise questions, if it was only, let's say, 100, you'll be able to see that it was 30% of the 300 patients that are in your facility. And as you continue to go down, all of them function like that. This is the area where you'll report the facility level accounts for the seriously ill patients. And so you'll just enter in, say we had 50, and you see when I change that, this is the denominator for all of these fields. These fields change as well, so you could see, like for example, the percentage of new seriously ill patients that you identified, the percent of them who died, and you could see that right as you're entering the data. Oh, I forgot to show. So this is the template for the dialysis centers, and if you were a CKD practice, you would click on the one that says CKD practice, and this is more tailored to your site, and this is where you would enter your data. And the name of the facility sites here are only the CKD centers, so if you're on a template and you don't see your facility there, you're probably on the wrong one, and you should switch over to the one that's most applicable to your site. Now we're going to talk about the patient level demographics and utilization report. And this is for us to track your seriously ill patients over time for the 3 months that you are reporting data on those patients. And so this isn't facility level, this is for each seriously ill patient. We ask that you kind of create a cohort in the first month, meaning that all the patients that you report on in May, that you also provide some documentation of them in June. So for example, if you see them in May and then they're hospitalized or they have died or anything may have happened and they're not in your facility or they've fallen out of care, we ask that you just let us know so we can track those patients so they're not present on the May list, absent from the June list, and present on the July list. When you're reporting a seriously ill patient, we ask that during the first of the week that you do a count of patients that came to the practice that were seen that were seriously ill. And then after you have that first number, you count all the new incident cases throughout the month. And then, but you'll report data for all of the seriously ill patients within the practice seen during the entire month. But during the first week, so for example, next week when May starts, we ask that you, at the end of the week, write down all the seriously ill patients that have been seen. And then that data will be entered onto the Pathways data reporting template under the seriously ill patient tab. And so the monthly data and the seriously ill data will be in the same Excel spreadsheet. It's just different tabs. And again, there's different tabs for the dialysis centers and the CKD centers. They look very similar. They function the same way, but they just have different measures. So, for example, if you're entering demographics, you would enter the patient identifier, and then you would, for each of your seriously ill patients, you would enter all this data for each of them. And again, there are validated fields for quite a few of these, so you must enter in a value from the drop-down box. If you find that you have more patients than spaces are here, feel free to just continue adding them on, and then subsequent months will update the template so you have enough room to enter all the patients for you. And this is what the seriously ill patient template looks like for the CKD centers. It works exactly the same way. You have the same drop down and you can choose from the validated fields. The only difference is the measures are different to better align with your facility. And the final reporting template is for the baseline chart audit. And this is going through the electronic health record to identify ACT information. So when you're searching for ACT, we ask that you kind of the best practice as you're looking through the chart is if there is a designated area in your EMR or EHR where that information is documented, look there first. If it's not there, then we ask that you do a 3-year look back, meaning that if you're doing the month of May and you hit April 2016, then you can stop looking. Or if you're looking for more than 10 minutes for each patient, stop. And we ask that you do that because then it's not clinically relevant if it's that difficult to identify the information. When you find an advanced directive in the chart, there aren't any date restrictions, and the spreadsheet for this template is baseline chart audit template. I will show you that one. So this is a template. It's very similar. It functions in very much the same way. So we have an overview. We just ask that you enter the site, the date you reviewed it, the reporting period, and the name of the person conducting the review. And then you just fill in the patient information here. And again, it has all the same drop-down functionality. We leave this here if it's easier for you as you're looking through your EHR to put a medical record number or ID number here. If it's easier for you as you're going through the chart to help identify the patient, please do not send that information to us. Please delete it before you upload, before you email us the template. This is just a picture of what I just showed you. These are some general guidelines for when you're submitting all of the reports. We're going to be getting a lot of reports from each of the facilities, so when you send a report to us, please report the facility name, the reporting type, and the reporting month in the file. So not the submitting month, but the actual month where the data is coming from. Send all completed files to Pathways. There is an underscore here, but because it's underlined, it's not showing. But it's pathways_data@gwu.edu. As a reminder, data can be abstracted from any part of the medical record, so don't feel limited to only one section. And again, remove all patient identifiers before you go ahead and submit it to us. I'm the data analyst on this project, so I'm the point person if you have any questions about data or anything like that, or anything about the template is confusing. We ask that you begin to think about and identify and let us know who will be collecting and reporting data at your site, and I'll probably be working really closely with those individuals. So if you could please email us a name to this email address, and this is my email address here. And for those data collectors that are reporting data to us, they do need to have city training, and we can provide if needed. So if you don't know what city training is or you're not familiar with it, let us know when you could help provide guidance on that. And this is the final overview of all the templates I mentioned. And if you're If you want an easy slide to refer back to, this is the one to show you what each of the reports are, what each of the Excel spreadsheets that there are, and what they're named. And then for the monthly report and the seriously ill patients, as a reminder, they are divided by dialysis center and CKD center, so you want to make sure that you are entering data into the site that best reflects your practice.
So thank you. Kim, why don't we keep it on you and you can just move the slides. So let me just emphasize one thing I realized we didn't make a slide for. You will be keeping a code link at your site that allows you to link between whatever is your identifier, your medical record number, and what you give us as the pathways identifier. You develop that pathways identifier on the spreadsheet. You put it in. And then we will have a copy, you will give us a copy of the code link so that we can link the patient level data to the interviews. The purpose of collecting the patient level data is to be able to compare and make some generalizability statements about the population who we actually survey. So now just some reminders that access to the templates instructions, they are in what we call the Pathways box drive, and many of you have gotten access to it already. But if you haven't, there are instructions when you go to this, the Pathways resources, and you go to Pathways box drive, this blue button that will take you there. And then within it, you navigate to action period 1 and to the data collection instruments and instructions. All the templates are there, all the instructions are there. We will also email those to whoever you tell us is your data collector. Kim, you can go to the next slide.
Sure.
So this is what, once you get into the intranet, the box, this is what it looks like. So here are the files. It's basically just a list of files, but we've tried to name them so that it's clear. And the templates, if you make it a little larger, you can see that you need to have the baseline chart audit template. That's what allows you to do the chart audit. And the monthly facility level report. That's instructions. The Pathways data reporting template, which has everything else you need as a template. Everything else is instructions. Okay, next slide. Okay, there we go. And this will be in when you get the slides, all the contacts and who to get in touch with. For data questions, first person is Kim. For access to the intranet, Amanda. For help with the QI process and interpreting the data, that's Glenda Harbert, who's our QI advisor. Just general questions about the project is Sherry Sliwa. And I see I spelled her name wrong. The interviews are going to be conducted out of the Clinical and Translational Sciences Institute at West Virginia University, and the supervisor of the interviewers is Louise Moore. And Woody Moss and I are always available as well to answer questions. I think there's one more slide, or is that the end? Yeah. Oh, yes. So this is where you can go for more Pathways information, the website, a narrated slide overview, and the animated explanation of supportive kidney care. And questions, I think. Yes. So